Now, one of the hard things about brain fog, at least for us, is, okay, your brain's not working well. I don't know why.
There's a lot of different reasons why you might have that. Neurologically, the mechanism is that neurons just aren't communicating or firing efficiently from one neuron to the next. So it's like the speed of conductance of that signal is slowed. Where is the culprit? What's the trigger? What's the underlying root cause of why your neurons aren't talking to each other like they should? Why is that slowed? So chronic fatigue syndrome, super tired. So you go through the course of the day and they wake up, they're okay. By the end of the day, they're going home, eating dinner, watching Netflix and going to bed. They have brain fatigue. Two questions we ask about brain fatigue is, do you get tired more quickly than you did in the past with reading or with driving? Okay, so those are huge metabolically demanding activities to the brain. And so if you do, then that's a red flag dose that we have to investigate.
And this gets lumped under depression a lot, gets lumped under anxiety, but so much of brain dysfunction doesn't really fit great under that lump.
The reason why patients feel depressed is because this part of your brain, your orbital frontal lobe, or orbital frontal cortex, does not fire or function the way it should to capacity. But still you're left with the question, why? Why is that part of the brain affected? Is it just this part of the brain? Probably not. That's the same part of the brain that controls decision making. So this is why a lot of depression patients have a really tough time making a decision. What do you want for dinner tonight? I don't care. I don't know. Like they go shopping, like there's 10 of something. What one do I pick? I'm overwhelmed. I don't know which one, right? Like it's hard for them to make decisions, and that's because it's the same part of the brain. Kelly Brogan's work and like her book, like Mind of Your Own, and some of our other colleagues, they've now transferred the theory to what's called the cytokine model of depression, which means inflammation. So obviously the serotonin model is still there, but the new research, they're really going after inflammation as the root cause of depression and then trying to figure out where that inflammation is coming from and why is that patient depressed. Yeah, you're just in menopause. So a guy, it could be testosterone.
People talk about mom brain or pregnancy brain, and how much the hormones really have to do with brain function. And so I remember learning about what stress hormone does to your brain and what estrogen or progesterone and testosterone do to your brain, and realizing that, oh my gosh, there's a lot of brain fog coming from these hormone problems. So we look at hormones for people with brain fog. And then into Hashimoto's and autoimmunity. Thyroid autoimmunity, you can target the brain. So you can have inflammation in the brain, creating brain fog.
Over 90% of the cells in the brain are now thought to be immune cells. Women, there's 3 big triggers in their life, hormonally and like immune-wise. It's puberty, pregnancy, menopause. Those are like the 3 stages where autoimmune disease can be triggered, right? So I get pregnant, then I have hypothyroidism or Hashimoto's or whatever, things like that.
They look more and more into gut, and oh my gosh, functional medicine in the gut. And you just go, well, there's a saying in functional medicine, gut on fire, brain on fire, happens the same way. So when we have gut problems and you find people with all kinds of irritable bowel disease, one of the most common things with irritable bowel disease is you get concurrent brain function problems. So we think that Alzheimer's as a general category is a huge issue in our aging population, and we do not agree that it is normal. It's common, but we really disagree that this brain deterioration we see with age is a normal occurrence. And if you look at some of the blue zones of the healthy, longest living people, you talk to people in their elderly years and their brain is still sharp and they're still so cognizant and so thoughtful and so responsive. And then, we've all talked to people who aren't that way, who in their later years you're going, oh my gosh, where are you? What's happening to you? And others around you can see it before they even, really realize it. And what we really find when we talk to these people about Alzheimer's and dementia stuff is they've had brain symptoms for years, things that they might describe as brain fog. And it usually starts out as funny or annoying things like, I always lose my keys, I always lose my phone, I put, the shoes in the wrong closet, I put, I just start to mix things up and people just kind of laugh or giggle, or they start to get lost more, or they don't remember little things. But it starts out that way. And we tell people that's not normal, healthy brain function. You should really be, sharp and cognizant and not making a lot of these, little mistakes. And it's when these little mistakes start to pile up and become, more repetitive, that we really want to step in and go, wouldn't it be better to help the brain now rather than you wait 10 years and then it's bad enough to where we go, oh my gosh, you have the beginnings of Alzheimer's.
Chemo brain after chemotherapy treatment, you might have a food sensitivity, underlying subclinical infection that doesn't show up on a standard blood panel, things like that too. Could be inflammation, high C-reactive protein, then you have to investigate. Well, is it a virus, a bacteria, a yeast, a fungus, a parasite? Is it a food? Is it a toxin? Is it too much stress in their life? There's symptoms associated with different issues, and it can be endless on what they come from. And that's our job as doctors, is to try to figure out, why are you getting brain fog? Is it from inflammation? Is it from hormones? Is it from food? Is it from, where's the source coming from? And just, that's where history comes into play, right? You get 80-90% of your results come from taking a good history.
And so that's where we come in and go, okay, we ask you a bunch of different brain questions. I mean, that's what some of our paperwork is, all these different brain-related questions. And that's why the exam from Dr. Paul is so important and really surprising for so many people.
Brain fog, it's not a diagnosis, right? It's a symptom. So like your medical doctor is not going to give you like an ICD-10 code. And remember, functional neurology is you're looking at how well does the brain work, how well does it function, which an MRI cannot tell you that. MRI tells you structurally is all the pieces in place. There's no stroke, there's no tumor, there's no abnormal blood vessel abnormality like an AVM they call it. They're really not the bad stuff, right? And then if it's like normal, then that's where like we come in and test how is the brain working.
When we go to a normal neurologist, which most people haven't been to, but even if you've been to, they're really looking for these big problems in your exam. They're looking for MS, they're looking for Parkinson's. We tell people they're looking for the bullet in your head. They're looking for, oh my gosh, I have a tumor. Oh my gosh, I have something that's so big and so obvious. We go, oh, this is a huge problem. These more subtle issues, but really that affect your life, but they're not a tumor. And we tell people there's a whole lot of nervous system problems that aren't a tumor. And this is what Dr. Paul's exam is really able to reveal. And people are shocked when they finish talking to my partner, Dr. Paul, about how bad their brain functions when he kind of pins them down and really starts to test it.